Hi everyone, this is going to be a lecture on inflammation and healing. Week 2, we're going to do chapter 5. So first of all, we're going to talk about, we have a couple different lines of defense. So we have first, second, and third lines of defense. Our first line of defense is a non-specific line of defense. We talk about the mechanical barrier, which would be our skin, mucous membranes. We also talk about secretions such as tears and gastric juices that are meant to capture those. The tears will flush out those pathogens, the irritants out of your eyes, and then the mucous membranes also work to trap those pathogens that could be invading your body and keep them from getting into your body. So they're the defense, so they're not going to let them inside your body to create disease. Secretions, gastric juices also are part of your defense mechanisms. Second line of defense is also non-specific, but we talk about this is more the cellular type of defense. So you get into phagocytosis at the cellular level, and then you talk about inflammation and what happens when you do have an injury or a your body gets some kind of trauma, and so your body starts these inflammation, this process to create these defense against further infection. Your third line of defense is going to be a more specific defense, and this is we're going to talk about the cell specific antibodies or cell mediated immunity, and that again is going to be more at the cellular level and what happens when your body responds to a specific type of pathogen or a virus or bacteria or something that gets inside your body to help it to keep the disease from spreading and becoming more pervasive inside the body. So your defense mechanisms, so again, we're looking at our non-specific defenses. This is just the diagram that kind of gives you a little bit more of idea what we're talking about. So you have your non-specific, which is your fluids, tears, saliva, mucus, and gastric acid. Those are the fluids. And then you have your skin and mucous membranes that are also create barriers to these pathogens. And then you have your phagocytosis. Basically, your phagocytosis, the phagocytes, macrophages will come in and basically kind of gobble up anything that's not you, and they think of as some kind of possible pathogen that will cause disease. Your specific defenses then again are going to be your immune response, and this is your cell-mediated and humoral mechanisms. And that again is going to be more at the cellular level. And then you have all the defenses that are working together to overcome this disease or injury that has occurred or potential for causing disease. So your capillaries, we're going to get at the cellular level. When we get into the body, you have your vascular system, and you have your veins and your arteries, and then as they get smaller and smaller, we come into a capillary system or capillary bed, and this is where your kind of venous and arterial kind of comes together and exchanges different fluids, different cells, and gets rid of it that way. So depending on the metabolic needs of the cells, it will pull out from the arteries what it needs for the metabolic needs, oxygen, nutrients, and then also it will get rid of the waste at this capillary level. So those arterioles in the capillary bed will bring in what the body needs, and then the venules or the veins at this capillary level will take away all the wastes that have accumulated in that tissue. Movement and fluid and electrolytes and oxygen, basically, like I said, are based on hydrostatic pressure. So basically, it goes from pressure of a greater pressure to lesser pressure, and this is how these get exchanged in that capillary bed. On the venous end, you can have osmotic pressure. Fluid will move based on the osmotic pressure. So basically, what has more molecules in it as opposed to less molecules. So the fluid moves from higher concentration to lower concentration, and that's how the venous end, they get rid of your carbon dioxide and other waste products of cellular metabolism. That's a very, very basic understanding of how your veins and arterioles work to bring oxygen and take away waste. So here's your normal capillary exchange versus inflammatory response. You see that in the normal capillary exchange that you have basically the veins and arterioles are this specific size, but then when you have inflammation, you have things that happen at the capillary level where they become more leaky is a term that we use, like leaky vessels, and then that's when molecules can move out of those capillaries and veins into the tissues and fight off the pathogens that are there. So this diagram kind of gives you a basic understanding of what that might look like at that capillary level. So physiology of inflammation. So inflammation is a protective response of your body. So it's going to happen when the body feels like it's being attacked or there is trauma to the body. So you're going to have an inflammation, usually a local inflammation at the site of injury. If you have a disorder that ends in itis, like cellulitis, you're going to have that inflammation, appendicitis, where your appendix is inflamed. So those are the disorders that are going to be localized inflammation of a certain area that is being attacked. It is normal defense. Again, this is something that your body normally does to bring it back to the homeostasis, because everything that our body does is meant to bring it back to the normal or homeostasis way of working. Signs and symptoms serve as a warning for problems. So basically, when you have signs and symptoms of inflammation, your body is telling you that there's something wrong, and it's telling you that we need to investigate a little bit further. It can be a very non-specific also defense mechanism. These problems, like I said, appendicitis can be hidden within the body, so we don't know it until we start having those symptoms like pain or nausea, like an appendicitis. So when we start having symptoms, we know that there might be a problem in the body, and it could be a result of an inflammation somewhere in the body. So inflammation does not necessarily mean that there's an infection in the body. So again, it's kind of more non-specific. It can be if you get a cut, if you get a sprained ankle, if you have a broken bone, there's going to be inflammation at that site of that injury or trauma. And so infection can cause inflammation, but it's not necessarily a specific indicator of an infection. So inflammation is a more non-specific sign in a way that your body is fighting that injury or disease. So causes of inflammation, what can cause inflammation? So direct physical damage, so a cut or a sprain, like we talked about. So direct damage, you twist your ankle gets swollen, you have a cut, that cut is raised, and you see the redness around there and the inflammation that happens around that cut area. Caustic chemicals, so if acid drain cleaner, if your skin is injured, or if there's like you get acid or drain cleaner on like your hand or your foot, somewhere on your body, you're going to see that inflammation because of the caustic chemicals. Ischemia or infarction, so if you have an area where you're not getting enough oxygen, let's say this happens a lot with diabetics, where there's they might have peripheral vascular disease and they're not getting enough oxygen to certain areas, and they start having ischemia. Your body is going to react by creating inflammation as a defense. Allergic reaction. So basically, if you have an allergy, pollen, you can see, or you're allergic to a cat or animals, and you rub your eyes, you can see your eyes swelling up. That is an allergic reaction. Your body is creating that inflammation to try and get rid of that allergen, pollen, cat dander, dust, something that's creating that reaction. Also, extremes of heat and cold. So very hot, your body will have inflammation. You get burned by putting your hand on the oven, or you are extremely cold, you get frostbite, your body's going to respond with inflammation. Anything with a foreign body, if you've ever had a splinter and you know that something that gets under your skin, and that it's going to be a localized inflammation telling you that there's something that's not supposed to be there. And of course, infection can also cause inflammation as well as other symptoms. But these are all causes of inflammation that your body uses as a defense against injury or a pathogen. So in the steps of inflammation, this is where we talk about more the cellular level. So we have basically once the cells, whatever cells that are injured, will release bradykinin. And bradykinin activates pain receptors, so that's what's going to cause you to feel pain at the site. So the bradykinin kind of tells that area, ooh, there's something wrong, and the pain receptors are activated, and that sends a message to your brain that, oh, ouch, that something hurts. Then you're going to have mast cells and basophils are going to release the histamine to bring in other molecules to the area to fight off whatever pathogen is there. Your capillary dilation, so basically your bradykinin and histamines are going to create this leaky and this dilated capillary bed so that the molecules can get into your tissue and start fighting off whatever is causing this injury. You'll have increased blood flow and capillary permeability. That increased blood flow is where you're going to feel that heat in that area, and it's bringing the things that it needs, the cells that it needs to fight that the trauma or injury to that area, and so you're going to have that redness and warmth because of the increased blood flow. Because your nonspecific defense, like your skin, may have been injured, you might have bacteria enter into that tissue. The neutrophils and monocytes come to the injury site. So you're going to see these neutrophils and monocytes, your immune system, head to that site to also mount a defense. The neutrophils will then phagocyze bacteria, or it can phagocyze anything else that it sees as a foreign body to not you. So it will see something that's not you, it's going to try to remove it from that area. And macrophages leave the bloodstream for phagocytosis of microbes. So the macrophage is going to leave those out that leaky capillary bed, and it's going to go into your tissues, and it's going to find those microbes, of bacteria, foreign substances that it sees as not being you, and it's going to try and get rid of those at that level. Acute inflammation. So the process of inflammation is the same regardless of the cause. So basically, if it's an infection, if it's a cut, if it's a sprain, the inflammation is going to have the same process no matter what. And the timing will vary. So you may have a delayed response, or you may have a very immediate response depending on what the cause of that injury is or the damage. Chemical mediators will affect the blood vessels and nerves in the damaged area. So how do the chemical mediators, what do they do in that damaged area? The mediators are going to create a vasodilation. So they're going to open up those capillaries so that they bring more blood into that area, more of the neutrophils and the chemical mediators to fight that the injury. And they will increase the capillary permeability. And then they send out these little chemical signals that will attract the immune system and saying, hey, there's something wrong here. We need you to come over here and help us fight this disease or this injury or whatever is causing the inflammation. So that's basically acute inflammation. It happens pretty quickly after an injury, but again, the timing can be different depending on what type of injury that is. So here's a good table to kind of go over. These are chemical mediators in the inflammatory response, and we talked about some of these already. So you have your mast cells or granule cells. The histamine is a chemical that is released by them, and this is what their action. They create vasodilation, increase capillary permeability, and they form the exudate. So if you have some fluid coming out of that injury, whether it's serous fluid, which is non-infectious, or you have the purulent fluid, something that is from an infection. Your chemotactic factors are created by the mast cell granules. Your platelet activating factors, your cytokines. So go ahead and I would have a basic knowledge of what these cell mediators do in your inflammatory response. And we'll talk a little bit more about the complement system and some of these other ones as well. So the local effects of inflammation, talked redness and warmth. The increase in blood is going to create redness and warmth to that area. The swelling is going to be because you have more proteins. The leaky capillaries are going to allow larger molecules to leave your vasculature and go into that interstitial space. And so basically fluid moves with those bigger molecules, creating this swelling and this edema. So that's why you get the edema, because it's bringing more fluid to that area and it's following the big molecules that are in there trying to fight the infection or whatever is causing this damage. Your pain, so again, you have the bradykinins that will tell your pain receptors that there's something wrong, and it will tell your brain that there's something wrong, and then you can, your brain was like, ouch, that hurts. So it will let you know that there's pain in that area. If you develop a lot of edema, like if you have a swollen ankle or swollen knee, you could actually, your function can be impaired because of this edema. It will interfere with movement because of the swelling. There's more fluid in that area. You might not be able to move it as easily. So you may have a little bit of loss of function because of a local inflammation. So this is, as you can see, this is inflammation around the face area. You can see all this redness and this swelling around her periorbital and forehead. So this is the chemical mediators and the swelling that is happening with local inflammation. So we talked a little bit about the exudate, the stuff that you have coming out, the fluid. So you can have a couple different types of exudate depending on if there's infection or what's going on in that area. Serous fluid is just your watery. It's probably yellow or white. It consists of some proteins and white blood cells. And then you have your fibrinous fluid that's a little bit that thick, sticky stuff that has fibrin content that is going to be there to help repair that damaged area. You're talking about your purulent. This is your infectious type of exudate, where it's thick and yellow and green. It has leukocytes and cell debris and microorganisms in this exudate. And you can have a localized pocket of it, so it could be like localized into one little area in the tissues. And then if you have hemorrhagic exudate, it sounds really sounds a lot worse than it can be, but it's when you have blood vessels are damaged and then you have bleeding or red blood cells that are being in that local injury area. So those are when you have the blood vessels damaged and the blood kind of leaks out. So those local effects of inflammation, but we talk about what our systemic effects of inflammation can be. So when you have some kind of inflammation, some kind of injury, your body's going to respond with a mild fever, or the technical term is pyrexia. So your body is responding to this injury by releasing pyrogens, which is going to increase your temperature. You also can be feeling not well, malaise, which means that it's nonspecific. This is a nonspecific symptom, so you're not feeling good, you're feeling blah, you really don't want to be doing anything. It also can be fatigued, so you don't have as much energy as you would have if you didn't have the infection. It can cause headaches. And then, this also can cause some anorexia, where you just don't feel like eating. So if you're sick and you have that fever, your body's going to respond and you're just not going to feel like eating very much. So we call that anorexia, when you don't feel like eating. So the fever, interestingly enough, this is how a fever is produced in your body. So we have, here's your normal temperature, your body's normal temperature. Then you have some kind of injury, some kind of infection, and your body is going to release these pyrogens into your circulation. And these pyrogens will then travel to your hypothalamus. And your hypothalamus is your temperature control center. So it's going to tell your hypothalamus to increase your temperature. So increase that baseline temperature. So this affects, this is going to help fight the disease. So then when you have a fever, that's your body trying to help fight the disease. So you have symptoms of a fever where you get this shivering, chills, might get vasoconstriction and look pale. Your heart rate starts going faster, and you may tend to, when you're having a fever and you're having the chills, your natural response is to curl up into and get as little of your surface area exposed to the air. So that's when you curl up and you're having these fever and the chills. So once your body reaches that high temperature, you're going to feel warm. So this is your warm part of the cycle and increase in body temperature. You're going to start feeling that warm. And then you might give a treatment like acetaminophen or ibuprofen, and that's going to reduce your temperature. So we treat the fever with medication, and then at some point this will help your hypothalamus reset to your normal level, and it will drop your baseline body temperature back to normal. So this is when all of a sudden you're having a fever, and we call it the fever breaks. So when your fever breaks, your body temperature is resetting back to normal, and you then, want blankets off, and then you spread out, and you're no longer curled up because you're feeling really warm, and you might get diaphoretic or sweaty, and you're still feeling lethargic. And like I said, you're extending your body, opening up your body to expose as much body surface area as you possibly can to release this warmth. And then your body will come back to the normal level. So this is how a fever works. And this is why fevers are also a good thing for your body. It helps to fight the infection. But it's important to know that the hypothalamus is the one that controls your fevers and controls your body temperature. Not your fevers, but it controls your body temperatures. So it's the hypothalamus. Changes in your blood. So basically, when we have an injury or we're having inflammation, we can have leukocytosis, and this can be in the setting of an infection or non-infection. If there's some kind of inflammation or damage to the body, you're going to have increase in white blood cells. So that's automatically going to happen. You're also going to increase your plasma proteins, which are your fibrinogen and your prothrombin. These are going to help to heal if you have an injury. The fibrin and prothrombin go to the area that's injured and help to, these are like clotting factors. A C-reactive protein. So we'll see an elevated C-reactive protein. That's a protein that's in the body, and that indicates there's inflammation and possibly necrosis. And this will get elevated within 24 to 48 hours after an injury and inflammation. You're also going to see an increase in erythrocyte sedimentation rate, or increased ESR. So the ESR means that there's plasma proteins are increased, and this is a test where the red blood cells settle, how fast the red blood cells settle in your plasma proteins. It's also a test of inflammation. It's kind of what we call a non-specific test of inflammation. It's just telling us that there is inflammation somewhere in your body when you have an increased erythrocyte sedimentation rate. So it's sedimentation rate, how fast those erythrocytes settle into a test vial when they take your blood. And then you also have cell enzymes, an increase in cell enzymes, because these enzymes are released from necrotic cells and they enter the fluids. So we can test your cell enzymes. If you're elevated, we know that there's some place that has been injured and that there's inflammation somewhere in your body. These, again, are non-specific signs of inflammation. We know that there's something going on wrong, but we can't diagnose it based on these tests. We just know that there is something going on in the body. So here's basically what happens, the course from injury to healing. It's a little algorithm that you see. You have your acute inflammation, and you're going to release the chemical mediators, and then your body, these chemical mediators help to bring your body back to where it was before, normal or homeostasis. And then we have their healing stage. And then our healing stage, we will have regeneration of the tissues to help heal if it's a cut, if it's an injury to the tissues, and then we have hopefully a resolution. Sometimes though, this healing stage will persist, and then we might have chronic inflammation, and we can have through this chronic inflammation, that's when scar tissue is developed, or we have just a chronic inflammation of some area that is chronically injured. So acute inflammation can lead to chronic inflammation. Again, these are some of, we talked about this already, your diagnostic tests. Necrosis is not a diagnostic test necessarily. Necrosis, we can usually see cell death. Necrosis you'll see in these other, some of the other blood tests, or we can see it on the skin when cells die, that those skins slough off and get replaced by new cells. So potential complications of inflammation. So inflammation can be caused by an infection, but it also can be a complication of the inflammation or the injury that has happened. So basically, when you have these injury to that skin, an injury to somewhere in your body, microorganisms will take this opportunity to penetrate that tissue that's swollen, that tissue with the leaky capillary bed, or the dilated capillaries. And so some of the microbes are resistant to the phagocytosis, so the phagocytes don't necessarily come and gobble up all the microbes. So if they don't, and some microbes are left over, they can cause the infection. And that's when you're going to see that purulent exudate, and that is actually can be actually a great medium for more microorganisms, or the growth of those microorganisms. So it kind of causes an increased infection. You can also have muscle spasms from infection or inflammation, and this is basically in that area where you're having the injury, your muscles will start to spasm because of the edema, and it's also protecting yourself, and it's a response to pain. So if you're having some pain, you might have a muscle spasm because your body is saying there's something wrong there, we're going to try and protect it, and then the muscles will react that way. So chronic inflammation will follow an acute inflammation episode. There's going to be less swelling. There still will be swelling, and there still might be some exudate, but there's going to be less because it's going to be there chronically. You have lymphocytes, macrophages, and fibroblasts in that area. Your tissue will continue to break down, and you might have more fibrous scar tissue, and you might develop a granuloma. If you have a foreign object, your body will kind of engulf it in this granuloma and try and keep it from getting anywhere else. So you might develop a granuloma from this microbe or foreign body or foreign object that's in your system. Prolonged inflammation. Because prolonged inflammation, swelling can impair your exchange of nutrients and oxygen to those cells, you might have create these deep ulcers. So the ulcers are a result of not getting enough oxygen to that area. That tissue is not getting the nutrients and oxygen they need, so that tissue is going to start to die off. And what's going to happen, it's going to create this ulcer. And you're going to not be able to, if they don't have those nutrients and that oxygen to regenerate, you're not going to get any new cells, so those dead cells will just kind of slough off and die off and create this ulceration in that skin area wherever the inflammation was. And if it's really severe, these ulcers can get really, really deep. They can go as deep, and they can work their way all the way down to the bone. So that's a potential complication of not getting enough nutrients and oxygen to those tissues to help them heal and regenerate. So how do we treat inflammation? Well, we have medications that we can use. So aspirin or acetylsalicylic acid, or ASA, can be used to help decrease inflammation. Acetaminophen, Tylenol, will fight inflammation, and you have your anti-inflammatory in the name. It's right there. It's going to fight inflammation, and that's your ibuprofen, or even like your Toradol. And then you have your glucocorticoids. So steroids, corticosteroids can help also fight inflammation. But you got to be careful with steroids. You don't want to use them for long periods of time because they will affect your immune system. But they are great for acute inflammation and managing an acute inflammation situation. So here again is also some of the common drugs that you use to treat, and you will show you what the different drugs and then how they work. Some of them have analgesic effects. As you notice, the glucocorticoid does not have an analgesic effect. So if you're looking at the antipyretic, also you also notice that the glucocorticoids is one of the ones that does not affect its the fevers, and neither does the COX-2 inhibitors. So these are just a good way of seeing what what adverse effects also of some of these medications can be. So if you give a lot of ibuprofen, you can have some GI distress. For aspirin as well, a lot of GI distress or ulcers can be created if you take a lot of aspirin. I have seen a patient who was he was a teenager, and he decided that he wanted to work out really, really hard, and he was sore, and he just, in order to deal with the pain and being the sore, he took a lot of ibuprofen and ended up with a stomach ulcer. So these drugs, some of these, especially over-counter drugs, they are great, but you need to be careful because they do have side effects. So that just make sure that you know what the potential adverse effects might be. Okay, so we talked about glucocorticoids and how they work on the inflammation. So they do have an anti-inflammatory effect. So what they do is they will decrease the capillary permeability, so it decreases the ability of fluid to move out of the capillaries into that system, so the edema will be reduced. It will enhance your effectiveness of epinephrine and norepinephrine, so you feel with more energy and more energetic. Reduce the number of leukocytes and mast cells, and also this is the adverse effect that you really want to be aware of when you're using glucocorticoids, is that you can have a reduced immune response. So your immune system can be suppressed when you're taking these for a long period of time. Short period of time, it might affect you a little bit, but it's really those long periods of time that you're going to have to be careful, because that can really reduce your immune response. More adverse effects of the glucocorticoids: atrophy of your lymph tissue, reduce of hemopoiesis means that the reduction of red blood cells, which they increase the risk of infection. It has catabolic effects, so basically your tissues will break down and you have a decrease in protein synthesis. So instead of anabolic, which is the growth of of increasing tissues, the catabolic means that they're breaking the tissues down. You're also going to have delayed wound healing or delayed healing if you take the steroids, and it could restrict growth in children. It can also make you retain sodium in water, and it can increase your blood glucose level through gluconeogenesis, so you can have a higher blood glucose level when you're taking these steroids. So those are potential effects that you can see when taking them. Short term, this should be fine, but again, long-term effects can be really detrimental. So you want to be aware of that if you are taking them or you have a patient that is taking these. So also you have some herbs so these are non-pharmacologic that people can use, or that they have these anti-inflammatory effects. So turmeric, black pepper, ginger root, rosemary, cloves, cayenne pepper, basil, peppermint, cinnamon, sage, coriander. All these herbs have been shown to have minimal anti-inflammatory effects. You'd have to take large amounts of them, and they'll have adverse effects as well. So you have to be careful that you're not treating yourself with large amounts of some of these other ingredients. But they do have some anti-inflammatory effects, some of these herbs and spices that are in your foods. We talk about rest or RICE therapy for the injuries, rest, ice, compression, and elevation. Now that's good for the immediate possibly, but is not good for long term. So really what you want to do is maybe at the short term you rest, you put some ice on it, you maybe have some compression and you elevate it, but you don't want to stay off of an injury too long. The new thought process is if you actually move and can walk on an injury, then you actually will increase the blood flow, increase the nutrients getting to that area, and will help to heal faster. Whereas if you just do the rest, ice, and compression elevation, it might take a little bit longer. But this is good for the acute phase or right after. Also, ice helps you feel better. Compression just kind of keeps the swelling to a minimum or just pushes the swelling to another part of your body. Other therapies that you can use is elevation of the inflamed limb. If you have a swollen knee or swollen ankle, when you're not using it, then put it up. Let the fluid come back naturally to your heart. Pull out of that fluids back into your vasculature and into your cardiovascular system. Mild to moderate exercise can also be very helpful. Again, it will increase your blood flow, which increase the oxygen, increase the nutrients that are getting to that area. Physical therapy, occupational therapy, and just rest. If it's pain, what you like to say is use pain as kind of your measure of doing too much. You don't want to fight through that pain. Pain is a response that your body has telling you that you need to pay attention and maybe rest it for a little bit while longer, or just not be as aggressive with your movement. Adequate nutrition and hydration is also very, very important. So make sure you get enough water and you get enough of the nutrients that you need, that your body's going to need to help regenerate these cells to fight this infection. So you're going to need all those good vitamins and minerals to help fight the inflammation. Types of healing. So you have a couple different types to consider. Your minimal tissue damage, you just have a resolution. So basically, if you don't have a whole lot of damage, it's going to go back to normal and you're a resolution of healing. Regeneration. So you have new cells that replace the old cells, and this is the regeneration of those cells that are functional. So hopefully they're functional. Sometimes the replacement cells are non-functional, and we'll talk about that. And the replacement. So functional tissue replaced by scar tissue. So sometimes you can have the scar tissue replace that functional tissue, and depending on the size of that scar and where it is, you might have some decrease or loss of function in that area where you have the scar tissue. So here is the process of healing. This is basically if you have a wound and what happens in the different phases. You first have the injury and inflammation, then you have granulation, and the epithelial cells regenerate and replace the damaged cells, and you may have a small scar that remains in the area that was the initial injury. So here's healing by second intention. So you have a larger area that's damaged. So the injury and inflammation is in this larger area. And then you have the granulation tissues that kind of start to replace and come into that area that was damaged. And then you have a scar, a larger scar in this issue. And this is when you can find that loss of function or decreased function when you have a larger tissue or a larger scar in that area. So scar formation. So you can affect your hair follicles, your nerves, and your pain receptors. So if those cells are damaged, your hair follicles are damaged, you may get no hair growth in that area anymore. If you ever have like a cut on your head, you can notice that area where you had the cut, you don't have hair growing in that area, or an incision somewhere where there used to be hair, that incision has damage those hair follicles and they're not growing back anymore. Sometimes if you go deep enough or in certain areas, you may damage the nerves, and the nerves will eventually regenerate, but you may have loss of just local loss of feeling that one little area where you had that injury. Contractures and obstructions. So basically, scar tissue is non-elastic. So when you get big scars and they affect areas by your joints or by movement, you could have contractures. So that scar tissue, because it doesn't move, it's going to pull maybe your the areas that do move and keep it from moving, and so you might have a contracture. It restricts your movement. Let's say if you have a big scar and a scar tissue on your knee, it may not allow you to bend your knee as far as it used to bend. Adhesions are when scar tissues will kind of adhere to other normal tissue. A lot of times you'll find scar tissue in like incisions, and it adheres to the normal tissue, and you can actually break up that scar tissue if you use some kind of mechanical manipulation in that area. But you can find adhesions when the scar tissue kind of joins to the normal tissue. So you also have, if you've ever seen big scars or like raised scars, these are hypertrophic scars. I mean, the scars kind of outgrow, there's an overgrowth of the scar tissue. So you have these bigger scars or bigger like raised areas that you have scars. And sometimes you have what you call keloid formation in that area as well. So those are the raised scars. Ulceration, blood supply can be impaired around the scar because there's not good, there's the veins and the arterioles may not have grown, or they may have been damaged in that area, so they may not have good blood supply. So you might see some ulcers around those scars. And that will result in more breakdowns. So you try and pay attention to those scars, make sure you get them enough oxygen, enough nutrients, so we can avoid the ulceration. Here's what you see as a big scar. This could be affecting his the way he opens his mouth. So the scar tissue right there, this big scar, can impede because it's non-elastic, it may be impeding how he opens, how wide he can open his mouth. Here's another keloid type of scar tissue. Again, this could be impairing her use of her arm. Also, I'm sure she doesn't like the way this looks. So there's just complications that can happen with scar tissue when there's overgrowth. So now we're going to talk about burns. And there's different types of burns that can affect that can cause damage. Thermal burns, flames or hot fluids. So basically getting too close to a fire, hot water, that can cause thermal burns, chemical burns, radiation burns, which can include burns from either the sun, but also from radiation if you're getting radiation treatment. Electrical burns, lightning strikes would be an electrical burn. Light, you can get burned from light. And friction burns. So if you ever like fallen down on a smooth surface and will slide across like a basketball court or something like that, you can get a friction burn, and that's when that top layer of skin can come off and cause injury. Superficial, so classification of burns. So we classify them based on how deep they go. So basically, a first degree burn is going to be a superficial or partial thickness burn. It's going to involve the epidermis, part of your dermis. You might have some, but you may not have blister formation because of this. And your next one, it goes a little deeper. So if it goes deeper and it affects the epidermis, you will have a deep partial thickness burn, or what they call second degree burns, and you will get blister formation from these burns. And then you have a full thickness burn, so when you get destruction of all the skin layers, and often you will hit down to the subcutaneous tissue, and that will be a 3rd or 4th degree burn, or they call it a full thickness burn. So depends on how much of your dermis is affected is what we're going to classify these burns as: 1st, 2nd, or 3rd degree burns. So here you go again. Your superficial burn is just on top where you have a little bit of redness, maybe no blister. Your 2nd degree burn, which is your partial thickness burn, it's going to blister and have this under the blister is going to be all that fluid in there. And then you have your full thickness burn. So it burns all the way through the dermis into your subcutaneous tissue. So the whole layer of your skin is gone. And those are really, really painful. Here's what they call a partial thickness burn. You can see the blisters on the skin there. So these are the partial thickness burns. That's just a picture of that. A deep partial thickness burn, as you can see, goes pretty deep, and you can see the blood there. So it's gone past all of the dermis and into the blood vessels and affecting the blood vessels. And you have a full thickness burn, so you have a burn that's all the way down to the 3rd degree level and all the way through the dermis and affecting your subcutaneous tissue. So you have local and systemic effects of burns. Burns can be, depending on how severe they are, can have a lot of systemic effects. Definitely the local effects, but again, larger areas of burn and the deeper the burn is, you can have systemic effects. So because you have the skin is a barrier and keeps water inside, you could have loss of fluid and can cause dehydration. But also you're going to have that inflammation as well. So you're going to have also edema in that area. So you're losing fluid, but you're bringing fluid to that area. So you can have both of those effects of your burn injury. If you lose enough fluid, if your burn is big enough or large enough and deep enough, you can go into shock. Depending on where the burn is, you can have respiratory problems. If you inhale and your respiratory system gets burned inside your throat, then you can have respiratory problems. Definitely pain, because you're affecting that first line of defense, your skin. You have the pathogens that are easily able to get past that defense that's no longer there, and that will cause infection. Your body goes through a hypermetabolism, so your metabolism goes way up. Your body is trying to heal itself, so it's working extra hard, and you have a high metabolic rate at this, and it can be acute, and your high metabolic rate actually lasts for a long period, even after sometimes the burns have healed or after you've experienced the burn. You can still be in that hypermetabolism state. So nutrition and nutrients and hydration is very important for burn patients. How we classify burns and how we determine what kind of surface, they had 45% of their body was burned. Well, how do you decide that? So we basically give a percentage to different parts of the body. So if you look on here, your head, the front of your head is 4.5% and the back of your head is 4.5%. Then you look at your front of your arm and the back of your arm, and that's each 4.5%. But if your whole arm is burned, then we call that 9%. So basically, if you look on here, it will show you how much each area of the body is given in terms of how much percentage of your body and where you're burned. They'll say what percentage of your body was burned. So this is one we use called rule of nines. Here's just some more examples of burn injuries, severe burn injuries that you can look at. We talked about hypermetabolism. So basically your body is in a state of hypermetabolism. Your metabolic rate increases in order for your body to heal. So when you are burned, they will cover it immediately. They will clean the wound and cover it immediately to prevent that infection because you're missing that barrier. This is a long process from burns. Healing is a very long process, can be a very long, prolonged process depending on how deep the burns and how much of your body was burned. Oftentimes there will be scar tissue will develop. And so what treatment for burns is skin grafting. So we take some healthy skin from one part of your body and put it over the skin that was burned. But you can still have scar tissue developing in that areas that you cover with the skin graft. So when you're skin grafting, they often take parts of, like, if it wasn't burned, they'll take part of your leg and put that skin from your leg and put it over that burn to heal and create new skin and close up that barrier. It's very important for physical therapy and occupational therapy. So in order to prevent scars and contractures, physical therapy and occupational therapy is very important. So moving the areas that were burned, keeping that skin from causing, and the scar tissue from causing contractures is very important. And so if you get to a point where you do have these scar tissue that is causing the contractures, they can do surgery to release those contractures and that skin and that scars, so to give you some relief and give you the function back, or the movement back in that area. So children and burns. Growth of children can be affected. Part of it is because their metabolic needs are compromised. So in normal growth, children need a lot of calories to grow. But when they're burned and they are in this more hyper metabolic phase, they're using all that nutrients and all that nutrition to help them heal. So they may not grow as their growth may be affected because of this hypermetabolic rate, because their body's trying to heal the burn area and not actually help their muscles and their bones grow. You can have the inflammatory mediators may cause renal problems because if they're large molecules and they get into your kidneys, or if you have muscle damage, the muscle breakdown will get into your kidneys and cause kidney problems. And you may have additional multiple surgeries to heal, or grafts to heal. And as children grow, they may have to have more because the scar tissue isn't elastic and doesn't grow like the rest of your body is growing. So you may have to have more surgeries to prevent the contractures and the complications of that scar tissue.